Bismillahirrahmanirrahim. Quote for today is, "And your Lord has said, Pray unto me, and I will hear your prayer." Today, the topic of my presentation is trachoma, and I'm presenting it under the supervision of my professor, Dr. Saira Afsar. Learning outlines of the presentation are introduction, epidemiological determinants, clinical progression, complications, prevention and treatment of trachoma, recent advances, and MCQs at the end. Learning outcomes are, at the end of this presentation, participants will be able to describe about the introduction of trachoma, its clinical progression, epidemiological determinants, prevention and treatment, along with MCQs at the end. Introduction of disease. This disease is caused by Chlamydia trachomatis. It is sorry. It is transmitted from person to person. It has multiple infections that lead to visual impairment and blindness. Blindness from trachoma is irreversible. Problem, really sorry. Problem statement is that trachoma is the leading infectious cause of blindness worldwide. It is responsible for blindness or visual impairment of about 1.9 million people. It causes about 1.4% of all blindness in the world. Blindness from trachoma is irreversible. It is a public health problem in about 44 countries. Based on data June 2021, 136 million people live in trachoma endemic areas and are at the risk of trachoma blindness. Trachoma is hyperendemic in many of the poorest and many rural areas of Africa, Central and South America, Asia, Australia, and in Middle East. Overall, Africa remains the most affected continent and one with the most intensive control efforts. Economic impact of trachoma is that that it cost in terms of low productivity from blindness and visual impairment is estimated at US dollar 2.9 to 5.3 billion annually. That increases to US dollar 8 billion where trichiasis is included. Burden of the disease is that public health problem in 44 countries, as I've already told, and that it is estimated in 137 billion at the risk in endemic areas. It has visually impaired or blinded approximately 1.9 million people till now. Africa is the most affected continent. Women need surgery for advanced disease up to 4 times as often as men. This slide shows distribution of trachoma in Pakistan. And this shows geographical distribution of trachoma. The areas with green color shows that there is less than 5% prevalence, with the yellow shows 5 to 9.9%, and with red color it shows more than 50% of the area that has trachoma. Globally leading cause of vision impairment is the trachoma, and more important clinical features that are that are affecting people are: first is uncorrected refractive error, second is cataract, third is age-related macular degeneration, fourth is glaucoma, fifth is diabetic retinopathy, sixth is corneal obesity, seven is trachoma. Now, epidemiological triad. Three factors are included: agent factor, host factors, and environmental factors. In the agent factors, first is the Chlamydia trachomatis, immune type A, B, or C, obligatory intracellular bacteria. Reservoir is that children with active disease, chronically infected older children and adults. Source of infection is ocular discharge of infected persons and fomites. However, communicability is low infectivity, infective as long as active lesions are present in the conjunctiva, but not after complete cicatrization. Host factors are age. Children from the age of 2 to 5 years are the most affected. Gender or sex, the prevalence is equal in younger age groups. However, in older age groups, females have been found to be more affected than males. Predisposing factors are direct sunlight, Dust, smoke, and irritants such as kajal or soma may predispose to infection. Environmental factors are season is the main factor. The higher temperature and rainfall favors the increase in fly population. April, May, and again during July and summer. Quality of life is the disease thrives in conditions of poor housing, inadequate hygiene, crowded household, inadequate access to water, and inadequate access to and use of sanitation. Mode of transmission is in communities where trachoma is endemic. Eye to eye transmission can be considered as a rule. This may occur by direct or indirect contact with ocular discharge of infected persons or fomites. For example, infected fingers, towels, or anything accessories that are worn in the eyes, like kajal or suma. Eye-seeking flies, for example, Musca species, it plays some role in the spreading infection by mechanical transmission. In countries where only sporadic cases of trachoma occur, general localization of chlamydia trachomatis urethral cervical may lead to venereal transmission. It has been shown that trachoma is a familial disease. When one case is detected, others will almost certainly be found in other family groups. This slide shows routes of chlamydia trachomatis transmission and potential interventions. First is person with ocular chlamydia trachomatis infection, then flies, fomites, fingers. Three F's are included. How flies are affected from animal husbandry, waste disposal, sanitation, and face washing lead to fingers. And from these, how we can control is or how these things can spread to uninfected person from fly control, sleeping patterns, laundry, hand washing, face wiping. If all these steps are taken, then a person can remain uninfected. Incubation period of chlamydia trachomatis is 5 to 12 days. Clinical progression is an individual's immune system can clear a single episode of infection, but in endemic communities or the reacquisition of organisms occur frequently. After years of repeated infection, the inside of the eyelids can become so severely scarred that is known as trachomatous conjunctival scarring, that it turns inwards and causes the eyelashes to rub against the eyeball, that is trachomatous trichiasis, that it results in constant pain and light intolerance. This and other alterations of the eye can lead to scarring of the cornea. Left untreated, this condition can lead to the formation of irreversible opacities, resulting in visual impairment or blindness. Age of onset is in very highly endemic countries. It can occur in childhood, though onset of visual impairment between the ages of 30 and 40 years is more typical. Women are blinded up to 4 times as often as men, probably due to their close contact with infected children and the resulting greater frequency of infection episodes. WHO has identified 5 stages in the development of trachoma: inflammation, follicular intense, then scarring, then interned eyelashes trichiasis, and corneal clouding opacity. In follicular phase, the early infection is 5 or more follicle, small bumps that contains lymphocytes visible on the inner surface of your eyelid. Second, eye is on highly infectious side and becomes irritated with a thickening or swelling of the upper lid. Eyelid scarring. Repeated infection leads to scarring of the inner eyelids, and the scar often appears as white line. Your eyelid may become distorted and may turn in entropion. While fourth stage trichiasis, the scarred inner lining of your eyelid continues to deform, causing your lashes to turn in so that they can rub you on the stretch and transparent outer surface of your eye. Corneal clouding or opacity is the cornea becomes affected by an inflammation that is most commonly seen under your upper eyelid. Continuous inflammation compounded by scratching from the interned lashes leads to clouding of the cornea. These are the diagrammatic representations of a normal eye. Inflammation in the follicular stage, inflammation that is intense, eyelid scarring, interned eyelashes trichiasis, and corneal clouding that is It may include light sensitivity, eye pain, eye redness, vision loss, eyelid swelling. Other causes are poverty that leads to crowding, declined water, less of the latrines. That all leads to lack of facial cleanliness, infection and reinfection, trachomatis inflammation, follicular and intense phase. However, all these can lead to blindness. Prevention and Control, or WHO, adopted the SAFE strategy in 1993. WHO's mandate is to provide leadership and coordination to international efforts aiming to eliminate trachoma as a public health problem. In 1996, WHO launched the WHO Alliance for the Global Elimination of Trachoma by 2020. The alliance is a
डॉक्टर
part
इस्मा
of
स्क्रीन शेयर प्लीज. स्क्रीन शेयर नहीं है.
mm, the alliance is a partnership which supports implementation of the SAFE strategy by member states and the strengthening of national capacity through epidemiological surveys, monitoring, surveillance, project evaluation, and resource mobilization. Elimination strategy, the SAFE strategy is recommended by WHO. SAFE S for surgery, that is for advanced disease. A is for antibiotics to clear chlamydia trachomatis infection. F is for facial cleanliness. And E is environmental improvement to reduce transmission. Then prevention strategies are environmental measures and antibiotics. In prevent environmental measures, modification in water use, fly control, latrine use, health education, proximity to animals have all been proposed to reduce transmission. Use of insecticide spray resulted in significant reduction of trachoma and fly density. Health education is also resulted in the reduction of the disease. While in antibiotics, WHO guidelines recommended that a region should receive community-based mass antibiotic treatment when the prevalence of active trachoma among 1 to 9 years old children is greater than 10%. Subsequent annual treatment should be administered for 3 years. Annual treatment should continue until the prevalence drops below 5%, and at lower prevalence, antibiotic treatment should be family-based. Management is antibiotics and surgery. In antibiotics, azithromycin or tetracycline is given mostly, while in surgery there is bilamellar dorsal rotation and corneal transplantation for corneal clouding. Elimination is the elimination of trachoma as a public health problem. Is defined as the prevalence of trachomatous tracheasis unknown to health system, that is 0.2% in adults aged more than 15 years. Prevalence of trachomatis infection follicular in children aged 1 to 9 years sustained for at least 2 years in the absence of ongoing antibiotic mass treatment in each formerly endemic district. Plus the existence of a system able to identify and manage incident trachomatis tracheasis cases using defined strategies with evidence of appropriate financial resources to implement those strategies. Trachoma elimination goals. As of March 7, 2022, 14 countries have reported achieving elimination goals. These countries are Cambodia, China, Gambia, Ghana, Islamic Republic of Iran, Iraq, Mexico, and Democratic Republic of Laos, Morocco, Myanmar, Nepal, Oman, Saudi Arabia, and Togo. 12 of those countries in black had validated by WHO as having eliminated trachoma as a public health problem. Trachoma, according to WHO, number of people at risk fell from 1.5 billion to 137 million in 2022. That is 91% reduction. 74% reduction in number of people with advanced disease, and 10 countries are validated for achieving elimination. The NTD roadmap together towards 2030 is built on three fundamental pillars that support global efforts to control, eliminate, and eradicate neglected tropical disease. First is accelerate programmatic action. Second pillar is intensity cutting approaches. And third pillar is change operating models and cultures to facilitate country ownership. Recent advances are An article recently published with the name A New Surgical Technique for Post-Operative Tracheomatous Tracheasis. Introduction is that the World Health Organization has identified management of post-operative tracheasis as one of the key remaining areas of the focus that is needed to eliminate blinding trachoma as a public health problem. We developed the bowel rotation advancement procedure to treat individuals who need repeat tracheasis surgery. Concludes that the surgery was developed considering the altered eyelid anatomy found in the post-surgical eyelid with the tracheomatous tracheasis, thinning of the eyelashes fragment and removal of post-operative scarring, improves the ability to advance and stabilize the eyelash fragment after external rotation. This shows promise as a procedure for improving outcome of repeat tracheasis surgery. Another article published is Medicinal Plants and Phytochemicals Effective Against Chlamydia trachomatis as the causative agent of trachoma. Conventional antibiotics are used for trachoma treatment. However, the pathogenic bacterium's complicated life cycle is a challenge to the treatment from their reduced sensitivities to conventional drugs. Thus, options are sorted in phytochemicals effective against trachoma uh, as a treatment strategy. Literature has identified the following phytochemicals: bacillin, berberine, catechins, and multiple others to treat trachoma. Now, coming towards the MCQ session, first MCQ is trachoma is a public health problem in 44 countries. Which of the following is true about the prevalence of active trachoma? Option A is the prevalence of active trachoma increases with age. B is that although the prevalence rates of active trachoma are similar in males and females, the later sequels are more common in women than men. C is the global prevalence of active trachoma is 10 million cases. And D is the second leading cause of infectious blindness, first being the onchocerciasis. Option B is the right one. Second MCQ is which of the following patients with trachoma, as defined by the WHO simplified grading system, are at highest risk of blindness? Option A, patient with trachomatous inflammation follicular. B, patient with trachomatous inflammation intense. C, patient with trachomatous scarring. And D, patient with trachomatous trichiasis.
C. C.
Option D is the right answer. Third MCQ is trachoma is a disease of eyes that may cause visual impairment and blindness if left untreated. Which of the following population is at lowest risk of attracting the disease? Option A, the population living in the conditions of poor and overcrowding housing, inadequate hygiene, and inadequate access to water and sanitation. B, in regions of high temperature and rainfall. C, adult females have 4 times less chances of developing visual impairment and blindness. And D, in region with lowest density of flies.
D.
D is the right answer. Lowest densities of flies, the areas that have less flies, are at the lowest risk of disease. Fourth MCQ is 4-year-old child belongs to a well-groomed family, recently come from Ethiopia, presented to their family physician with a complaint of red eyes with discharge from eyes, irritation, and photophobia. He never experienced this before. The doctor suspected him a case of trachoma. His parents worried about his vision loss, how the doctor should have to counsel them. Option A, the disease once occurred leads to permanent vision loss. Option B, surgery is the only option to prevent blindness. Option C, a series of repeated infections may lead to blindness. And option D, there is no good use of good hygienic measures to prevent reinfection and visual loss.
C.
Yes, C is the right answer. Fifth MCQ is which of the following is true about WHO's safe strategy to reduce transmission of chlamydia trachomatis? Single oral dose of azithromycin is more effective for managing trachoma then topical tetracyclines. All four components of the strategy has been proven effective in multiple RCTs. C is with the strategy. WHO is aiming to eliminate trachoma by the year 2040. And D is surgery is the most effective and safest method for preventing trachoma.
C.
Option A is the right one, while WHO aims to eliminate trachoma by year 2030. 6 MCQ is you have been appointed as a district health officer of district Dera Ghazi Khan and you noticed a huge number of patients infecting with trachoma. Which public health measures you should adopt in the district to prevent the spread of trachoma? A. MES, drug administration of single oral dose of azithromycin when the prevalence of active trachoma among 1 to 9 years old is greater than 5%. Subsequent annual MES antibiotic treatment should be administered for at least 5 years. Annual antibiotic treatment should continue until the prevalence drops below 5%, and only health education regarding frequent face washing and insecticide sprays are sufficient. C is the right answer. Antibiotic annually should be continued till the prevalence drops below 5%. A 32 years old beggar presented in IOPD with red and swollen eyes. On examination, his eyelashes have moved inwards and towards the eyeball and touching the cornea with the visual opacity of 5 out of 6 in both eyes. Which treatment option is the best for him to prevent visual impairment? Option A, practical facial cleanliness and avoid touching his eyes with fingers. B, a combination of oral and topical antibiotics. C, surgery to remove the eyelashes touching the cornea. And D, frequent cold water sprinkling in the eyes.
B.
Uh, C is the right answer. As I already told, to prevent visual impairment, surgery is the best answer. 8th MCQ is you're working as an airport medical officer in Jeddah, Saudi Arabia. One Hajj pilgrim with his family from Sudan seeks medical assistance for his ongoing trachoma infection. What will you advise for the prevention and management of trachoma? Option A, avoid too much physical activity. B, avoid using others' towels and clothes. Option C, remain quarantined for 1 month. And option D, prescribe antibiotics to him alone.
B.
Yes, option B is the best measure that should be taken in this case. Ninth MCQs, the literature review suggests that adult females develop 4 times more trachoma-induced blindness as compared to males. Due to which reason? Option A, more usage of eye makeup. Option B, close contact with the children. C is venereal disease affects eyes. And D, decreased immunity in females. Option B is the right.
A.
Close contact with the children is the more common cause. Although A can also be a reason, however, the most common cause is B. 10th is the picture shown in the figure is a 35-year-old man who is suffering from trachoma. He is at which stage of the disease? Option A, inflamed conjunctiva. Option B, entropion. Option C, trichiasis. And option D, corneal clouding.
D. Corneal clouding.
B.
It is at the stage trichiasis as eyelashes can be seen inwards moving. This is the key of MCQs. These are the references. This is the YouTube link of our channel, and thank you.